Now we will review the features of the base of the skull. First, anteriorly, let's look at the hard palate. The hard palate is broken into an anterior two-thirds and a posterior third. The anterior two-thirds are made up of the palatine process of maxilla. So this is part of the maxilla bone. The posterior third is made up of the palatine bone itself. So we have the palatine process of maxilla and the palatine bone. As we look at the posterior opening into the nasal cavity, we see these openings here, which are called the choana. And in there you can see the concha, this here being the inferior concha and the middle concha, and you can't see the superior concha in this view. We have the medial and lateral pterygoid plates, paired. Projecting inferiorly off the medial pterygoid plate, we should have the hamulus. The hamulus serves as an attachment point for the pterygomandibular raphe. As we move backwards, we'll see a few of the foramen that have come through from the floor of the skull. And we'll discuss some other foramen that we won't see on the floor of the skull. So to give you an idea, when we turn this guy, the skull around, and look at the floor of the skull again, you might recognize this foramen as being the foramen lacerum, which in you and I is covered in cartilage. Foramen lacerum. Laterally to it, this oval-looking foramen is foramen ovale. And then slightly lateral and posterior to foramen ovale, you have foramen spinosum. Moving posteriorly from there, we see this foramen here, which actually doesn't enter into the base of to the floor of the skull. This is the carotid canal, where the internal carotid artery will enter into. Moving laterally and posteriorly still, we have the stylomastoid foramen, which is conveniently located between the styloid process and the mastoid process. Here on the occipital bone, there's a slight projection. We'll see if you can see it as I turn it sideways. We have a slight projection of bone here. And this is the pharyngeal tubercle. The pharyngeal tubercle ends up being an attachment point for the midline raphe or the pharyngeal raphe, and also the superior constrictor muscle. Continuing to move posteriorly, and actually now we're moving a little bit medially, we have the jugular foramen. In this view, you can also see the hypoglossal canal. Foramen magnum becomes pretty obvious on the occipital bone here. We have our occipital protuberance. We also have our occipital condyles, responsible for articulating with the first cervical vertebrae.